Hey everyone, my name is Dr. Geyer. I'm an integrative physician here in Scottsdale, Arizona. I'm making this video for patients and non-patients, so I'm introducing myself for my non-patients. I have been on this kick to cover continuous glucose monitors because they've been a game changer for me. And so I broke this up into a few different videos. The first video, we covered how I use continuous glucose monitors and why they're a game changer for me. The second video, I talked about how to apply them and what you need to know about application, insurance, knocking them off, all of those fun things. And then the third video, I talked about the app, which is amazing. Continuous glucose monitors often come with a glucometer that you can swipe, and the ability to finger prick, which is really important if somebody's really low because that's the most accurate. And then they also have the app, and I really love the app because it allows you to log your foods and share them with me. Today, I'm going to talk about sharing them with me and what that actually looks like. So I'm just going to start the share portion because I set myself up as a patient so I can show you, and there's no HIPAA violations there. And then later on, when I have information logged, I'll come back for part 2 of what it looks like through your physician or your clinical team on their end for when you share information. So I'm going to share my screen over and give you an idea of what I'm looking at. Okay, so FreeStyle Libre has a website. Physicians can actually log in at that website, create a profile. Once they do, they can actually add patients. And so that's what I've done. I've gone ahead and added myself as a patient. I don't have any glucose history in here yet because I haven't actually accepted it on my end. I just wanted to show you what this would look like on my end. Now, on what I received as the patient was an email, an invitation to share. So my clinical practice is called Empower Integrative Health. This is what the email will look like for patients. You can see it's the FreeStyle. That's what I chose to go with, and that's what I use with my patients. Your healthcare provider invites you to share your diabetes care information. You accept the invitation. Please make sure to review the below practice contact info. Make sure that it's the right practice that's inviting you. I'm assuming if you're looking for this, then it is the right practice. This is what it would look like, and you accept your invitation. And this is what it looks like on my end. Okay, so I haven't actually created an account other than my physician account. So I'm going to get started over here. This is the first time I'm doing this, so I don't know if I'm going to do it right, but I'm going to show you all anyway so we can take this ride together. So I'm in the US. I'm going to accept and accept. I've already read through all the privacy notices because I needed to do that for the app. And then you're going to add your information, and I'm going to stop share here for a second. Not that I really care about anybody knowing my birthday, which my birthday is next month, if anybody wanted to know and wants to send me anything. I'm just kidding. But actually, it'll ask you to create a password on the next one. So I will share that over so you can see what that next one looks like. There you go. I'm going to stop share. I'm going to add in my own password. It loves to suggest all these crazy passwords, which I am not going to use. Okay. Do they match? I hope so. My passwords never match. Doesn't like my email either. So it's going to take a little bit longer than I thought. Completely novel email, check, check. Okay, so let me share this with you so you can see what's happening. This is what it looks like. So we sent a verification email. I had to use my professional email. You're going to open it, you're going to verify it, come back to this page and press the next button. So let me do that real quick because I'm going to walk you through the whole shebang. That's what I said I would do. Email verification. Verify email. It's opening. I don't know why it's making me verify my country again. And I have successfully verified. That's fantastic. Okay, now I'm going to share again so you can see. Check, check, share screen. I evidently have to talk out loud when I do these things. Next, let's see if it'll go to the next screen. There we go. Let's stop share. And put in my personal phone number so Clement is not trying to find a verification code for me. It'll send you a verification code. And I'm going to share over again. And that's what it looks like. So getting started, upload devices, link to a practice. Let's see what it does for me here. Again, we're taking this ride together. All right. That was not helpful, as these things often are not. And then that's done. What I'm assuming will happen on the other side, I'll be able to see this all in here. So it does look pretty similar to what I see as the physician's side. On the patient side, you should be able to see your glucose history and actually break it down. So that's sharing your glucose information from your continuous glucose monitor to your provider, what it's going to look like on both sides. So if you're a provider, now you know how to invite your patients. If you're a patient, now you know what to expect. And if your provider doesn't know how to invite you, that's what they can do. And then there's all these cool graphs and these ways that it breaks it down that makes it super easy to kind of dissect the information and use it clinically. So I hope that was helpful, and I hope you have the most wonderful and blessed day. Bye.